In relation to artificial nails worn by perioperative staff, the Joint Commission, the Association of Perioperative Registered Nurses, AORN, the Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO, hold the following positions. A. Artificial nails must not be worn in the OR. B. Artificial nails are safe when worn under double gloves. What is the best way to define surgical gut? A. Suture made from nylon. B. Suture derived from the collagen of the submucosal layer of sheep, cattle, or hog intestine. C. Type of non-absorbable suture. D. Suture made from the intestines of a cat. The perioperative nursing assessment on a breast biopsy patient reveals that she is crying, hence the following nursing diagnosis is most likely. A. Fear of anaphylactic reaction. B. Fear of missing work. C. Fear of body image change, pain, or death. What is the primary goal of perioperative nursing? A. Preparing patients for surgery. B. Providing postoperative care. C. Ensuring a sterile environment. D. Administering anesthesia. Which phase of the perioperative process involves the assessment of the patient's medical history and physical condition? A. Preoperative. B. Intraoperative. C. Postoperative. What is the primary responsibility of a perioperative nurse during the intraoperative phase? A. Administering anesthesia. B. Preparing the operating room. C. Assisting the surgeon during the procedure. D. Monitoring postoperative recovery. The purpose of a surgical timeout is to A. Check the patient's vital signs. B. Confirm the patient's identity and surgical site. C. Verify the surgeon's credentials. D. Review the surgical instruments. Which of the following is a potential complication of surgery that a perioperative nurse should monitor for during the postoperative phase? A. Hypothermia. B. Tachycardia. C. Hypertension. A patient undergoing surgery has a latex allergy. What precaution should the perioperative nurse take? A. Use latex gloves during the procedure. B. Avoid latex-containing equipment and supplies. C. Administer antihistamines preoperatively. D. Ignore the allergy as it is not relevant to surgery. What is the purpose of positioning the patient properly during surgery? A. Improve the surgeon's visibility. B. Enhance patient comfort. C. Prevent pressure ulcers. D. All of the above. The correct sequence for donning personal protective equipment, PP, in the operating room is A. Gloves, gown, mask. B. Gown, mask, gloves. C. Mask, gloves, gown. D. Gown, gloves, mask. A patient is experiencing hypotension during surgery. What intervention should the perioperative nurse prioritize? A. Administering additional anesthesia. B. Increasing the fluid infusion rate. C. Informing the surgeon of the situation. D. Positioning the patient's head lower than the feet. In the postoperative phase, what assessment parameter is crucial for detecting early signs of respiratory distress? A. Heart rate. B. Blood pressure. C. Respiratory rate. D. Temperature. Which of the following is a common complication associated with immobility during surgery? A. Deep vein thrombosis, DVT. B. Hyperglycemia. C. Hypothermia. D. Respiratory alkalosis. The primary purpose of surgical hand scrubbing is to A. Remove dirt and debris from the hands. B. Achieve a sterile environment. C. Soften the skin. D. Promote circulation in the hands. During the intraoperative phase, what is the role of the circulating nurse? A. Assisting the surgeon with the procedure. B. Monitoring and documenting the procedure. C. Administering anesthesia. D. Managing the sterile field. What is the purpose of a surgical drape in the operating room? A. Enhance the patient's comfort. B. Provide a barrier to microorganisms. C. Absorb blood and fluids. D. Improve the visibility of the surgical site. The primary responsibility of the scrub nurse is to A. Monitor the patient's vital signs. B. Prepare the operating room for surgery. C. Assist the surgeon with the procedure. D. Manage the sterile field and pass instruments. Which of the following is an essential component of the perioperative assessment? A. Family medical history. B. Social security number. C. Religious beliefs. D. Blood type. The purpose of preoperative teaching for the patient is to A. Reduce anxiety and fear. B. Minimize the length of surgery. C. Speed up the recovery process. D. Decrease the need for anesthesia. A patient is scheduled for surgery and asks about the potential risks. What is the nurse's best response? A. There are no risks associated with the surgery. B. I'm not sure, you should ask the surgeon. C. Provide a detailed explanation of the potential risks and benefits. What action should the nurse take if a surgical instrument is suspected to be contaminated during the procedure? A. Continue using the instrument. B. Set the instrument aside for later use. C. Notify the surgeon and replace the instrument. D. Clean the instrument with an antiseptic solution. A patient is allergic to iodine. What alternative solution can the nurse use for skin preparation before surgery? A. Chlorhexidine. B. Hydrogen peroxide. C. Alcohol. D. Betadine. The purpose of preoperative fasting is to A. Enhance the patient's mental clarity. B. Prevent aspiration during anesthesia induction. C. Speed up the recovery process. D. Minimize the need for postoperative pain medication. What is the primary goal of surgical draping in the operating room? A. Enhance the patient's comfort. B. Create a barrier to microorganisms. C. Absorb blood and fluids. D. Provide a non-slip surface for surgical instruments. During the preoperative phase, the nurse should assess the patient's understanding of the surgical procedure. What question is essential to ask? A. Do you have any pets at home? B. Can you explain the surgery and its purpose in your own words? The perioperative nurse is aware that a patient's history of smoking can affect A. Blood pressure. B. Wound healing. C. Respiratory rate. D. Temperature regulation. What is the primary purpose of the surgical hand scrub? A. Remove debris and dirt from the hands. B. Achieve and maintain asepsis. C. Soften and moisturize the skin. D. Promote blood circulation in the hands. Which of the following is a potential complication of inadequate preoperative fasting? A. Hyperglycemia. B. Hypovolemia. C. Aspiration. D. Hypothermia. The perioperative nurse is responsible for ensuring that the surgical site is properly marked before surgery. What does this involve? A. Marking the site with a permanent marker. B. Verifying the patient's identity and the surgical site. C. Communicating with the surgeon about the site. What is the purpose of wearing a lead apron during surgery? A. Protecting the surgeon from radiation. B. Enhancing visibility in the operating room. C. Preventing infection. D. Improving ergonomics. The circulating nurse is responsible for A. Assisting the surgeon with the procedure. B. Managing the sterile field. C. Documenting the surgical procedure. D. Providing emotional support to the patient. A patient is allergic to a specific antibiotic that is commonly used during surgery. What is the nurse's appropriate action? A. Administer the antibiotic and monitor for adverse reactions. B. Notify the surgeon and request an alternative antibiotic. C. Disregard the allergy as it is not relevant to surgery. What is the purpose of the surgical timeout? A. To take a break during surgery. B. To verify the patient's identity and the correct surgical site. C. C. To discuss the surgical procedure with the team. D. To review the surgeon's credentials. The scrub nurse is responsible for A. Managing the sterile field and passing instruments. B. Assisting the surgeon with the procedure. C. Documenting the surgical procedure. D. Providing emotional support to the patient. What is the primary purpose of using a tourniquet during surgery? A. To control bleeding. B. To enhance visibility. C. To immobilize the patient. D. To prevent infection. The perioperative nurse is aware that prolonged immobility during surgery can increase the risk of A. Respiratory distress. B. Deep vein thrombosis, DVT. C. Hypertension. D. Hyperglycemia. A patient is scheduled for surgery and is concerned about postoperative pain. What is the nurse's appropriate response? A. You won't feel any pain after the surgery. B. The pain will be minimal, and we'll manage it effectively. C. Pain is a normal part of surgery, you'll just have to endure it. The perioperative nurse should monitor the patient for signs of malignant hyperthermia, a potentially life-threatening condition associated with A. Anesthesia. B. Surgical site infection. C. Hypovolemia. What is the purpose of the surgical mask worn by healthcare providers in the operating room? A. To protect the patient from infection. B. To filter out airborne particles. C. To enhance visibility for the surgical team. D. To improve communication between team members. The perioperative nurse is responsible for preventing surgical site infections. What action is crucial in this regard? A. Administering prophylactic antibiotics before surgery. B. Changing gloves frequently during the procedure. C. Allowing family members to visit the patient in the operating room. A patient is scheduled for surgery and has a history of difficult airway management. What intervention should the nurse anticipate? A. Administering additional anesthesia. B. Preparing for intubation with a difficult airway cart. What is the primary purpose of maintaining a septic technique during surgery? A. Enhancing patient comfort. B. Preventing infection and contamination. C. Improving surgical visibility. D. Speeding up the surgical process. The perioperative nurse is preparing a patient for surgery and identifies a latex allergy. What precautions should be taken? A. Use latex gloves and inform the patient of potential reactions. B. Avoid latex-containing equipment and supplies. During the preoperative phase, the nurse should verify the patient's consent for surgery. What is the primary purpose of obtaining informed consent? A. Financial billing purposes. B. Ensuring the patient's understanding and agreement to the procedure. What is the primary responsibility of the perioperative nurse during the postoperative phase? A. Monitoring and managing pain. B. Preparing the operating room for the next procedure. C. Assisting the surgeon with the procedure. D. Administering anesthesia. A patient is scheduled for emergency surgery. What is the nurse's priority action during the preoperative phase? A. Obtain a detailed medical history. B. Complete a thorough physical examination. C. Ensure the patient's safety and readiness for surgery.